My fellow delegates, much has transpired in the 6 months since we last met. We witnessed a hard-fought presidential campaign and the presentation of a controversial Supreme Court decision on the Affordable Care Act. These two events have shaped the course of health care reform in the United States, at least for the next 4 years. But many aspects of how this federal law will be implemented remain unclear and unfunded. In Massachusetts, the legislature finally passed a comprehensive bill to control health care costs and also to foster a new model for the delivery of health care in our state. It may be years before we understand all the changes that this law will generate. At the ballot box, voters in our Commonwealth narrowly rejected a proposal to legalize physician-assisted suicide and accepted one that legalizes the medical use of marijuana under state law. Both ballot initiatives have already begun to change the political landscape. That's a lot of activity for a 6-month period. But we have very little time to stop and collect our thoughts because there's a lot more work to be done on behalf of physicians, patients, and our time-honored profession. Let's take each of these issues one by one. The state payment reform and cost control legislation is complex. The law is referred to as Chapter 224, and it took effect on November 5th when the 11 members of the Health Policy Commission were sworn in. Dr. Kara Allen, an active member of MMS for many years and a recently retired pediatric medical director for the Harvard Vanguard program, serves on the commission. I'm happy to say she was one of our nominees to serve on the commission, and we're delighted she was asked to participate. The commission is only the tip of the iceberg. The state government is slowly beginning to address the 350-page law. It's already apparent that some of the sections will need technical corrections and amendments. We have put special focus on the sections that impose substantial administrative burdens on practices, especially those involving public reporting and provider registration. We also believe that the bill has taken the concept of transparency too far, and we will work to make these requirements more reasonable. Given the complexity of Chapter 224, MMS is preparing leadership training programs for physicians who will be addressing the law's requirement on behalf of their practices. The state is also beginning to implement one of the sections of the legislation that we favor the most, the introduction of the disclosure, apology, and offer system for medical liability claims. I want to acknowledge the tireless work of Dr. Alan Woodward and the Committee on Professional Liability for starting this dialogue many years ago and for guiding the concept to final passage this summer. Alan, would you stand? Thank you. Finally, with regard to Chapter 224, there's a lot of work yet to be done. The rulemaking process isn't very glamorous, but it's just as important as the lawmaking process, and we intend to be active players in the field. On the ballot questions, our voice was certainly heard in both the physician community and the general public. We implemented a comprehensive education campaign on both issues. We sent white papers to every MMS member in Massachusetts and distributed patient education flyers throughout the state and on our website. There were literally hundreds of news articles citing our opposition to each question. Almost every news story on either question 2 or question 3 mentioned the position of the Massachusetts Medical Society. Several MMS leaders, including Linda Young, who we just had up here, and Barbara Rocket, myself, and others spoke at hospital and medical school programs prior to the election, sometimes directly debating a supporter of the ballot questions. As you know, the physician-assisted suicide question did not prevail, and we are grateful for that. But we must still take action by offering our members and colleagues training in compassionate end-of-life care. CME programs are being planned on these issues. However, the question on medical marijuana did pass and will soon be the law of the land. It's no surprise to us that people across the state are asking a lot of questions and there aren't a lot of answers yet. The most important question for physicians is, what exactly must physicians do when the law takes effect January 1st? What are our rights, our responsibilities, and what are the risks, both clinically and legally? Today, it would be preferable if we had a clear answer to these questions, but we don't. There is more confusion than clarity. Detailed regulations must be written by the Department of Public Health, which already has its hands full with pressing issues. Nonetheless, physicians are getting questions about this from their patients every day, and they need answers. So to fulfill this need, our legal staff quickly produced a detailed commentary about the law. This document was posted on our website on November 16th. Immediately, it became one of the most heavily viewed documents we've ever had on our website. As you know, we have a late resolution on the medical use of marijuana, so I think this topic will be discussed thoroughly today and tomorrow at this meeting. We will watch this matter closely during the regulatory process. When we learn more, we will provide more documents on our website. In Washington, the election settled who will be president and who will rule the House and Senate, but it did not settle all the issues that we face. The future of the ACA is all but assured, but the future of Medicare and federal programs is anything but certain. Congress has already begun its lame duck session and has some critical decisions to make, which they, as of this morning, they haven't made, I can assure you. How can the so-called physical cliff be avoided? Will Congress block the 27% Medicare cut that's scheduled to take effect on January 1? The AMA continues to fight for a permanent repeal of the SGR to stabilize both Medicare and the federal deficit. The AMA argues that simply kicking the can down the road on Medicare payments makes no sense because that makes the problem worse. The only sensible answer is to end SGR and move forward with a new payment model for Medicare. The AMA hopes to address the immediate cuts during this coming month while setting the stage for a more permanent solution next year. We completely support the AMA's approach and stand ready to assist with outreach to our congressional delegation as needed. As you know, our delegation has been great in supporting this issue with us, and we will work with them to ensure continued support. These important advocacy issues are occurring against the background of tremendous change in the practice environment. For example, over the past few years, we've seen many physicians leave independent practices and become employed. Running a small practice was never easy. For physicians who choose to do so, many continue to feel it's worth the effort. But for many, the demands of today's healthcare environment tilt the balance in the opposite direction. For some, being employed is looking better and better, especially when you factor in the capital investments for technology that every practice must make. The transition to employed status is just one of these changes that we're seeing, and we must adjust to, and I understand there'll be discussions today with some of the resolutions around the rights of employed physicians. We have entered a period of continuous evolution in healthcare. There's no end point in sight, there's no finish line in or end of the race. This environment calls for a continuous improvement approach. That would typically entail surveying the environment on a regular basis, identifying the challenging opportunities, developing a plan to adjust to the environment, implementing the plan, and finally assessing the results and making further adjustments as needed. And that is what you are doing here today and will do again in May. The most important thing to remember is that these cycles often occur very quickly. The most successful organizations in the world learn to thrive in chaotic times, and this is a useful model for us to follow. At the same time, we're different from the typical business organization. We have a duty to honor the core values of our profession. We must maintain our collegiality and cohesiveness as physicians, even when certain issues threaten to divide us. We must recognize diversity of opinion, but not allow disagreements to define us. We must also foster the next generation of physician leaders through our great traditions of education, training, and mentoring. And we must continue to support our physician colleagues and ourselves with regard to our well-being. We have a lot of work ahead of us. These are challenging times, and they give us the opportunity to make things better. Let us take this opportunity at this meeting to honor our traditions and values while continuing to serve as leaders in healthcare reform. Mr. Speaker, this concludes my report.